Good morning, everybody. This is Craig Fierro. I just want to remind everybody of some housekeeping goods. If you have any questions, please put them in the chat bar so I can see them. Currently, everybody will be muted so we don't get any feedback and sounds really better. I will have the questions in the chat bar open to help Mary out. The handouts are available in your handout section. They're both PDFs. If you need different versions, please put it in the chat bar and I can email it to you directly. We're still trying to make sure everybody gets here, so give us a couple more minutes, and then we'll be on our way.
All right, everyone, we're going to go ahead and get started. I'd like to do some introductions. You just heard from Craig Fierro. He's our program assistant in development and training, among many, many other things, and he's helping me with the technology today. Also, we've got several other staff members, if you guys would introduce yourselves.
Hi, everyone. My name is Casey Hendrickson. I'm sure I've spoken with some of you already. For those of you who haven't met me over phone or email already, I am your HMIS data analyst. So every month when we are required to conduct the SSVF uploads to the HMIS repository, I am the one that conducts those reports and helps address any data quality issues for you.
I'm Sophia Cheka. I'm the Coordinated Access Specialist. So over the last almost 2 years, I've been traveling across the balance of state working with 7 pilot communities on implementing coordinated access.
And I am Jesus de Leon Serratos.
There he is.
Yes, sorry. I am Jesus de Leon Serratos. I have met a lot of you as well. I'm the HMIS project manager, and I'm really excited to be here and working with you all.
Thanks, Jesus.
All right. Well, you're seeing the agenda on your screen, and so I think just quickly I want to go through if anyone has, oh, you know what, actually, why don't we let all of you introduce yourselves very quickly. I'll unmute you one at a time. Let's start with Alex.
We're here, Alex and Michelle.
Hello.
Hi.
And maybe also say where you're from, because I don't know if all of you know each other. Barbara.
Barbara Irving, Director of Veteran and Housing Services with Career and Recovery Resources.
All right. And then Cheryl. Cheryl, can you hear us? Well, Cheryl Turner's on the line. Let's move to Irma. Irma, with Family Endeavors, are you on the line? All right. Well, we will go to the next person. Kiki.
Hi, Kiki.
And you're from USS in Houston, right?
Yeah, I'm here.
Okay. Lisa Lozano.
Can you hear me?
Yes.
Okay, I'm Lisa.
We just got Cheryl is here. Hi, Cheryl.
I'm sorry, Lisa. Go ahead.
Oh, SSVF, Families in Crisis in Killeen.
Great. Thank you. Lisa Robinson.
I'm here. Can you hear me?
Yes, we can hear you.
Okay, great. I am here.
Melissa?
Can you hear me now? There we go. I'm
Yes.
Melissa from Catholic Charities. I'm the program manager for our SSVF program.
And you guys are in the Fort Worth area. Michael?
That's you. Hit send. No microphone. Just type no microphone, I guess.
Okay, Michael wrote in, says, Mike, Dave, Ashley, and Keith are there in Lubbock with Star Care. Tamara?
Hi, can everyone hear me?
I can hear you. Great, thanks. And Tracy? Tracy, can you introduce yourself? All right, well, he's Tracy Sepulveda with Community Health Corps. All right, so welcome again, all of you. And the first thing on the agenda is just updates to contact information. I was just curious, I know several of you have added some people to the email list, so I'm guessing those are new people working in your program. But if you have any other updates to the contact info, just email me and let me know so I can make sure that I'm sending things to all the right people. And if there are any changes to your project coverage areas, I'd like to know that as well. Some of you were still in a state of flux a little bit on some of the overlapping counties issues. So if any of that has changed and you haven't told me about it, just let me know. And local homeless coalitions in the Balance of State CoC, we're still updating that list, but we will have that done by next Wednesday because we're presenting it to our CoC board, the updated, currently accurate list. And so I can certainly help you get in contact with your local homeless coalitions in the area you cover if you're not already connected. All right, let's move into the bulk of the business for today. That's the community plan updates. So I first wanted to start with reviewing our version of the CoC-wide plan that we submitted to the VA on May 1st. And as Craig said, you all can see this too on your screen, or it's in your handouts bar. All right, this will look very familiar to you because each of your projects, or for the most part, has its own community plan, although we do have a few joint ones in the Houston area and the San Antonio area. But let's scroll down here. I had sent this to you guys on May 1st, but we never went through it officially. So these are the people I have listed right now who are on the primary planning group for the BoS CoC, and really I included people whom I had talked with about their community plan specifically, but everyone is welcome to be on this group, and all the calls can be open to everyone, but I would like to have an official group recognized, so let me know if you want to be on that and you're not currently. Ongoing review and coordination, you'll see that unlike in your plan, which was very specific to your project in your local area, we try to write this section from a CoC level. And so we talk about how THN works with our other CoC members, and that's the way we're going to be working with you guys, which is kind of an overarching approach to things that doesn't get to the ground level like you might have in some other community plans. Like I know that Houston CoC has a lot more involvement, the lead agency does, with the SSVF grantees than we are going to have on the BoS level. And so just a little bit about, you know, that I had attended the launch in LA, which is where I met a lot of you. We pulled together this community plan really quickly. At that time, our preliminary results showed that we would have potentially excess PH placements, meaning that with our SSVF resources and the other housing resources currently operating in our CoC, the VA gaps analysis tool showed that we would in fact meet the need and get to 0 by the end of the year. So that would be incredible if that happens, because certainly that's the goal of all of what we're doing right now. We talked a little bit about that we'll compare local and CoC-wide data as we're going along, and we'd certainly talk about definition for functional 0, and again that we would try to connect you with any other CoC-related resources that we could if you're not already connected. All right, then we get into section 3, and again that will look familiar to you. All of these numbers are coming from the SSVF edition of the VA gaps analysis tool. So I will pull that up. Let's see, I think I need to scroll down, sorry. Yes, here we go. So again, you all have one of these. Sorry, it's scrolling on me and not letting me stick up there. This one is for the entire BoS CoC. So you all probably saw this too, that according to our point in time count, we would have 775 people, veterans, where we did have in the geographic area. And that number we couldn't change in this tool. At the time, the estimated count for 2015 was 620. We don't have the current numbers for veterans across the BoS yet, but our data specialist, Lindsay Marsh, is working on that, so I will be able to update this by the time we submit this plan on July 1st. And so based on that, it's estimated that 1,507 veterans will be homeless in 2015. So this is where the 1,507 number came from in the community plan. You just get to it. There, 1,507 estimated annual total. Then, as you see the tool working through of how many people might need which kinds of interventions, looks like 1,256 veterans need successful interventions to achieve permanent housing. So 1,256 is our need. Then it goes through, okay, 379 of those need only successful rapid rehousing assistance. 92 need HUD-VASH and rapid rehousing. 8 need VA residential treatment and rapid rehousing. So the total that we need for successful rapid rehousing in 2015 is 479. And again, this is all calculations included in the VA's gaps analysis tool. The next section is what we're actually going to be able to provide, or our assets. Now, all of these numbers came from the worksheets that you all sent to me, those SSVF grantee worksheets. So let me just show you here. This was our master CoC worksheet that includes all of your projects across our CoC. So this was FY 2015 quarter 2, which was January through March. And some of you had not even gotten started yet, and so there are some zeros there that you wouldn't have exited any of your participants by then. Here is FY 15 quarter 3, which is what we're in now, March through June. And you'll see it calculates all the way across at the column that says veteran exits per quarter. That's your total number of veterans that you're exiting in both prevention and rapid rehousing. The next column over is the proportion of those who exited that had been offered rapid rehousing. Next is the proportion of exits for people who exited that rapid rehousing program into a permanent housing situation. And then therefore, based on all of those, the number of veteran exits from rapid rehousing to permanent housing. So you'll see for this particular quarter that we're in, we were estimating 163 people. So I'll be curious to hear from you guys and work with Casey to see how many people you were actually able to exit in that situation. And that's the kind of thing I think that Tamara is having you update her on during the monthly Texas calls. All right, so similarly, quarter 4, 185. And then the last quarter that we were asked about is our highest at 193 people. So if you all have some significant differences in these numbers from what you submitted on May 1st, it would be really great for me to get updates. The VA isn't asking for updates by July 1st, but you could use updates and then include that in your updated community plan if you want to update the numbers in addition to the narratives. All right, any questions on the worksheets and the projected exits to permanent housing? Did you have any questions come in?
Nothing yet, but remember they can always put them in the questions bar if they have any.
Yes, you can put them in the questions bar. Also, you can do the raise a hand feature, and that will indicate to us that you have a question you'd like to ask, and we can unmute you to ask it. Okay, so let's go back to the gaps analysis tool. So based on all the numbers that we just saw, I plugged them in from those worksheets into this chart, and it shows that we will have 688 veterans altogether exiting from rapid rehousing to permanent housing. And you'll see these numbers across the bottom are exactly the ones I just pointed out to you on worksheets. And our total is 688. Sorry about that. So again, we needed 479 we have 479 veterans who will need successful rapid rehousing assistance. And we've got projected 688 placements, and that's where we come up with this, right there, 479 is the need, 688 placements, and so according to the tool, we will not have a gap, and therefore we will in fact meet the need and potentially have excess placements of 209. And then these are the total number of veterans that would need interventions of any kind: permanent supportive housing, rapid rehousing, VA residential programs, non-VA programs, HUD-VASH. But according to the tool, we will have 1,533 of those assets. So again, right now it's showing that we will not have a gap in meeting the need, which is incredibly encouraging. I hope that encourages you. Of course, with this tool, we can't tell what the distribution of that need is. So there might be some cases where in any one community we wouldn't be meeting the need, but across the CoC, this is showing that we would meet it. But we can certainly talk about any individual community gaps that aren't necessarily reflected in this aggregate number. All right, so that's where the numbers in the tool, in the community plan came from. You'll see, again, 1,507 estimated annual total. Ooh. I have a touch screen, and sometimes it goes a little fast on me. All right. The next set of numbers are length of time homeless. Overall, in the BoS, we've got a 27-day average. Most of you had 30 days, but there were a couple that had less than 30 days, so it brought our overall average down to 27 days. So That's an ambitious goal, and again, we know that for most of you it was 30 days, so I think that's what we're going to kind of look at as time goes on. But I'm glad to see that some of you are aiming for shorter lengths of stay. Hopefully we will all get there. Then the next numbers, how many veterans we think would be counted in the 2016 point in time count. I got these numbers again from all of your plans. We thought 259 as homeless and 84 as chronically homeless. And I don't quite understand how that relates to our overage of placements that we just saw, where we said the tool was showing that we would have an excess placements. Tamara, do you happen to know the answer to that? Let me unmute you just a second. Okay, Tamara, I've unmuted you.
Okay, I was actually curious about that too. So I think I'm going to send this plan to our TA providers and ask them if there's something going on with the sheet, because that doesn't make any sense to me either, to have a surplus like that and then still have chronically homeless left over and people unsheltered left over. That doesn't make any sense.
Yes, and I'm showing you on the screen now the chart that I use to do all the tallying. And so some of your rows don't have any numbers in them because your plan is combined with someone else's plan or something like that. But you'll see it, we've got the 259 and the 84 there. So I know they came from your plans. I'm just a little confused about how that is working together. Does anyone else on the line better understand the tool and can help us out here? If so, like raise your hand or send it in a question. I'd love to hear from you.
Was there a number for the 2015 that like showed the same thing? Because maybe this is supposed to show a reduction.
A reduction in what? I'm sorry?
Maybe they're hoping that in 2016 you'll see a reduction in the like.
Yes, yeah, that's definitely the idea, is that we'd show a reduction in the point in time count, but I think the hope is that we would be to 0 by the time of that point in time count. But this might reflect that the projections do go through March of next year, so perhaps by the time of the January point in time count we wouldn't have reached our total goal. But thank you, Tamara, for offering to look into that for us. All right. This section on implementation strategies, again, each of you filled those out, and so I took the aggregate answers, and across the CoC, you'll see we're mostly under development on all of these. Has your community identified every veteran who is homeless right now by name? Obviously, we're not going to be doing that as a CoC-wide endeavor, but you all in your communities are going to be doing that. Does every veteran have a housing plan? Is every veteran who becomes homeless rapidly engaged and offered shelter? And some of you, again, had just started your program when these community plans were due, so that I'm sure that's a reflection of some of that. Are sufficient SSVF resources allocated to ensure there are no rapid rehousing gaps or turnaways? The majority of you had yes in your plan, so we had an overall yes. And are you using SSVF to rapidly rehouse veterans who are waiting on VASH or other PSH assistance if VASH is not available immediately or in the near future? Yes. In fact, I think at least one plan pointed that out as a weakness that they were really trying to address because they felt like they were spending too much of their SSVF money on short-term housing while the people are waiting for HUD VASH. All right, other strengths and challenges on a CoC level. We talked a little bit about how the balance of state, or we at THN have been the balance of state lead agency for since 2006. So we do have some connections out there as well, and we're used to working across the broad geography. And so in that way, that brings experience. But there's also a challenge, as many of you noted in your plans, about covering such a large geographic area. You can't really meet in person very easily. It's hard to establish relationships. But you all had some really great ideas of what's currently working and what you all had in planning stages to reach out to more local groups and get your planning and operations going. And I hope that, now Sophia has told me that a number of you are also working with your local homeless coalitions on the coordinated access implementation. So that's great. That looks like just page 1. Let me see. No, I guess that's it for the community plan currently. So, thank you all for going through that with me one by one. I thought it was important to show you how your information is rolling up into this larger plan, and then of course anything that you all do add or change and send to me will be incorporated into this plan. What we don't have in this plan, however, because it's a CoC-wide plan, are your individual narrative sections, like your community's strengths and challenges, and your community's ongoing review and coordination. But I have read all of those, and I would love to see those updated, because again, some of you were just getting started when these May plans were due. So if you have updates, send them to me. And so right now, the next thing on the agenda, let's go ahead and let me just offer to you if anyone would like to talk about some specific changes that you think would be helpful or important for the entire group to know. Just raise your hand or send it into the question box and we can talk about it. Because I think, you know, you all learning from each other can be very helpful. And I did see some great strategies in your community plans. One in particular I'll talk about as we're waiting to see if anybody wants to talk. Some of the community planning groups have involved the county Veterans Outreach Specialists, I think they're called? No, Veterans Officers. Oh, I can't remember their names now, the exact title. Yes, but if you haven't connected with those guys in your communities, that would be a great addition to the team. Okay, we've got a question. Do we need to submit our updated plan to VA in addition to you? No, you all will submit your plan to me, and then I will aggregate everything and send it to the VA that will reflect all the grantees in our entire CoC. So for balance of state, if your project is only in the balance of state, send it to me, I will send it to the VA, and it will be incorporated. Or, you know what, Tamara, is that correct from your perspective too, or do they need to go ahead and submit theirs as well?
It would all need to be submitted to, if you're taking the lead, then to you to be aggregated into the one plan. And actually, I've had a technical assistance provider contact me asking specifically to do some very focused TA with Texas Balance of State. So if y'all wanted to think about what you could use from our TA providers, they can be really helpful. And I'm going to start with maybe a call and we can discuss the plan and why it's not showing the correct reductions. And then he can talk about anything specifically that he can offer to be of assistance to you guys.
Thank you for that. I think that would be an excellent opportunity for us since we are getting big and a little hard to coordinate. And I feel like, again, as a lead agency, we can't be quite as involved with you all on the local level as maybe some of the other CoC leads can in a much more contained CoC. Any other thoughts or questions that you'd like to talk about with the group? well then we'll move on, and certainly if you do think of anything, send it into the question box or raise your hand. So I would like to have your updated plans by the end of the day next Wednesday, if possible. That's June 24th. And I've already been talking with some of you over the past couple of days as we've been trying to schedule this meeting about some specific updates. And I've also gotten a couple of revised grantee worksheets that you all were able to update based on your March through June data. April through June data. So thank you for that, and I'm definitely open to talking with you about all of that if you want to give me a call instead of emailing. And then I will aggregate everything and reread everything and send it out to you all for review before submitting it to the VA on July 1st. I don't actually have that on the agenda, but I will make a point to do that so you can see it before it's submitted. And you can send them to me, Mary, M-A-R-Y, at thn.org. That's THN for Texas Homeless Network.
What was that date you wanted again?
Next Wednesday, June 24th. All right. Well, I already reviewed the current inventory worksheet as we were going through the plan, and the aggregation and tallies that we used for the May 1st plan. Those were the next items on our agenda. And again, if you have any updates to your grantee worksheet that you want to share with me, just send it over. All right. I think the last thing on our agenda is to talk about future meetings. Again, let me go back to who our current, while I have it, here's the little map I had created for P2 communities. I think I have that up to date. P3, P1, and then all the counties by color code. Mostly the same as what I had shown you in LA, and definitely all the same that I've emailed you since that time. But if you do have any updates or I've got something incorrect, let me know. And then I know more recently Tamara has given us the official map and contact info from the VA as well. All right, so here are the people that I've got on the primary planning group right now. Again, these were ones I specifically talked with as we were getting ready to submit the May 1st plan. Meg, Randall, Suzanne, Lisa, Bridget, Bobby, David, Estrella, Lisa, and Alex, representing grantees. And then we have a couple of VA staff members who have agreed to serve on our team, and that's Amanda Donlan with the VA Texas Valley Coastal Bend Healthcare System, and Tammy Wood, the VA North Texas Healthcare System, and our THN staff. So again, if you all are comfortable with this group being the primary planning group, then they would be the ones that we'd want to make sure are on the call. I'm guessing we'll do it every month. If you want your name added, let me know. And of course, all of you will be invited to participate, so you can not be on the group but still join the phone calls. But that group, I think, will be very helpful with not just meeting, but working on a TA plan or request, as Tamara has offered. So that could be a really great place to get your voice heard and your project's voice heard, to make sure that we're giving you, as the CoC, and the VA is giving you what you need to make your projects successful. Because your success is ultimately all of our success. All right. Does anyone have any announcements for today? Thank you. Sophia just had a good question. I'm not sure the best way that we can find a day and time for regular meetings of this primary planning group. I think I could send out a doodle poll and see right now what might work for all of you. If you want to email me separately, though, and tell me there are certain days or times that you absolutely cannot attend. I know some of you unfortunately had that situation today, that you have another commitment on Fridays at either 10 or 11, so you couldn't join us, and I'm sorry about that. It's really hard, as you know, to find a time that works for everyone. Oh, and on that note, actually, let me remind you, we are recording this webinar, and so we will send out a link to all of you so you can listen to it again, or you can pass it on to other people that you would like to hear the conversation who weren't able to join us today. So yes, I will send a doodle poll for a regular meeting date or day and time, and you're welcome to email me if you have any specifics that you want to make sure I consider. Okay, anything from THN staff that you guys want to add or announce?
Conference is happening this year in Corpus Christi. If you haven't registered, you might want to move fast on that. Last I heard, the hotel rooms were halfway out of that booking, so you might want to move on those. We have so far 7 sessions built out, everything from veterans, case management, youth, Theo, Texas Homeless Education Office will have 2 tracks themselves. If you have any questions pertaining to conference, you can email conference@THN, and we can get you those. Other than that, that's all I had.
Yeah, and if you remember, if you were on the last call with Tamara, the Texas SSVF call, Jennifer Paulson with our office, she's our conference coordinator. She had asked you all specifically if there are sessions that would be particularly helpful to you that you'd like us to make sure and add. So, you're always welcome to email her directly at jennifer@thn.org. Because, again, we want to make sure that we're giving you what will help you the most. And in order for us to do that, we need to hear from you about what that is. Okay, well, if there are no other questions or announcements to be made, I think that wraps up our phone call. And we will certainly be in touch via email over the next couple of weeks as we're finalizing our finalizing our plan to be submitted to the VA, and as we're choosing date and time for our next call, and as Tamara is helping us get some targeted technical assistance. All right, so I think we'll go ahead and say goodbye for today, and thank you all very much for your participation. And I hope you have a great weekend. Bye.